So coming on to the irregular heart rate. Now, how we know that this ECG is irregular? First of all, there are three large boxes in between these two R waves, whereas in here there are four large boxes. Therefore, this heart rate or the rhythm is irregular. Now, how to calculate whether the heart rate in a irregular rhythm? For calculating the heart rate in a irregular rhythm, it is the number of, we have to calculate the number of R waves in 6 seconds multiplied by 10. Now, the 6 seconds means 30 large boxes. Okay, so if we calculate, these are 30 large boxes present in this diagram, and the number of R waves are 1, 2, 3, 4, 5, 6, 7, 8, and 9. So 9 into 10 is equal to 90 beats per minute. So the heart rate in this ECG is 90 beats per minute. Now, coming on to the axis of the heart. The axis of the heart means the direction of electrical impulse of the heart. Now, suppose this is the heart. Okay. So, then this will be the normal axis of the heart. See, the normal axis of the heart is from minus 30 degree to 110 degree. Okay. Now in this diagram it shows the normal axis of the heart. This pink color is from minus 30 to plus 90. Now there is one confusion. The confusion is that I had told you that the normal axis of the heart is minus 130 to 110 degree. So it will be slightly more than this 90 degree. And this will be also included in the normal axis. Now, so suppose for calculating the axis of a heart, we first see the lead 1 and lead AVF. In lead 1 and in lead AVF, we will check the RS pattern. Suppose in lead 1, the R wave, see, this is R and this is S in lead 1. If R is greater than S, then it is a upstroke. Then in lead AVF, we will check that the R wave is greater than S wave. Here also the R minus S is more than, the R is more than S wave, then it is also a upstroke. Now in lead 1 it is positive, that is upstroke, this is lead 1, and in lead AVF R minus S is also positive. Okay, so R minus S in lead AVF is also positive, so it is a normal axis deviation. Okay, similarly, now there is another example of R minus S. I'll check the, okay, so in this lead, if the R in lead 1, the R is greater than S, then it is a positive lead, whereas in AVF the R minus S, the R is smaller than the S wave, therefore it shows a negative deflection. So in lead 1, I'll make it here. In lead 1, it is positive, but AVF is negative, means now I will draw it like a dotted line. The AVF is negative. Okay. So this is a left axis deviation. Are you getting my point? Okay. Now, again take a next example. Suppose if this R minus S in this is the R and this is the S. The R minus S is negative, so it is a downslope. And in lead AVF, the R minus S is positive, then it gives a upstroke. Therefore, in lead AVF, is negative, lead 1, and AVF is positive. Therefore, this is a right axis deviation. Okay. Let us take one more example of extreme axis deviation. I'll choose my pen first. Every time I change my slide, I have to choose my pen. So this is a little bit. So let us take another example for extreme axis deviation. In lead 1, the R wave is smaller than the S wave, so it shows a negative deflection. In lead AVF also, the R wave is less than the S wave, therefore it shows the negative down slope. Therefore, for extreme axis deviation, lead 1 is negative and lead AVF is also negative. Then this is the extreme axis deviation. I hope you understand all the points very carefully. Thank you.